The Health and Human Services Secretary launching a new initiative over concerns doctors are overprescribing some popular medications. As of 2026, roughly 44 million Americans take those pills. That's about 16.6% of adults. The number of people taking those medications surging over time. You can see the steady climb over 15 years right here, where it lands right now. The secretary's push aimed at the most commonly prescribed antidepressants, including Prozac, Zoloft, Lexapro, and Paxil. Here to discuss is the New York Times' Ellen Berry, who focuses on mental health and is reporting on RFK Jr.'s new initiative. Ellen, thanks for joining Top Story tonight. So we want to ask you, can you walk our viewers through exactly what RFK Jr. is proposing and why?
Sure. He announced a number of initiatives yesterday, all of them focused on helping people to get off psychiatric meds. The first one is a mechanism that would allow providers to be reimbursed for helping patients stop taking medications or reduce them. The second is what's called a Dear Colleague letter, which just directly communicates to hospitals and providers that they should not look at pharmaceutical treatment as a default, but try to find non-pharmaceutical treatments like therapy, exercise, nutrition, et cetera. And then the third thing that he did is started in motion an expert panel that will begin to formulate guidelines for deprescribing and tapering off SSRIs.
Yeah, you know, that second point you mentioned there, RFK Jr. saying doctors should encourage alternative methods before prescribing these medications. What more do we know about those alternatives, and are any of them effective?
I think there's lots of good evidence that other mechanisms, things like sleep and exercise and nutrition, but especially psychotherapy, are really effective treatments for depression and anxiety and other disorders. However, they're not as easy to get. Often it's hard to find therapists. It's hard to find therapists who take insurance. And so a lot of Americans may not be able to access those modes of treatment.
Yeah. The American Psychiatric Association appeared somewhat receptive, right, to the initiative, but then released a statement writing in part, "We strongly object to framing the national mental health crisis as primarily a problem of over-medicalization or over-prescribing." What are they, explain the framing that they're against here.
So I think the concern, as you said, they were pretty welcoming of these steps and said that they hope to be part of the process of putting together guidelines for helping patients to taper or reduce medications. But yeah, as you said, a concern that this message is going to undermine confidence in treatments that are really our first-line treatments for some pretty serious disorders.
Yeah, you posted on social media that you're getting tons of responses in the comment section for your reporting on this. What stood out to you?
Yeah, I always watch the reader comments, and last night they really kind of exploded, and I would say really on two separate sides. There were many people who responded, keep your hands off my medication. This is a private medical decision, and the Secretary of Health and Human Services has no role in influencing it. But then there was also a group of people who talked about their own difficulty and sort of unexpected difficulty when they decided to get off the medications, that the withdrawal effects were just much more debilitating than they had been told. So you're really hearing two different stories.
Ellen, great to have you on the show. We appreciate it. We thank you for watching. And remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.